Welcome. I'm Steve Clemens, editor-at-large of The Hill. Thanks for joining us today for our program, COVID-19 and the Opioid Epidemic, an in-depth look at how the pandemic has exacerbated the opioid crisis and the path to saving lives. I'd like to thank our sponsor, Indivior, for its support of today's event. In the shadow of the COVID-19 crisis, the opioid epidemic still rages across much of the nation. It's everywhere. According to the American Medical Association, more than 40 states have reported increases in opioid-related mortality, as well as ongoing concerns for those with a mental illness or substance use disorder, and it goes on and on and on. Believe me, folks, this is a big deal, and that's why we're paying attention to it today. So what do? One of the priorities of healthcare groups is to remove barriers to addiction treatment. Could increased access to medication for opioid use disorder be a turning point? And how can we address disparities in access to treatment? To answer these questions and more, we have an outstanding lineup of speakers, including 2 U.S. senators, treatment providers, and advocates. Before we get underway, a few housekeeping notes. You can tweet us at The Hill Events, all one word, The Hill Events, using the hashtag #TheHillOpioids. We're broadcasting live and we'll be taking your questions throughout the program. As with any live stream, you could experience some trouble with your video. They say to refresh it. I hope it works for you. They say it will. My first guest is Senator Sheldon, Whitehouse of Rhode Island. I spoke with him just a short while ago. The opioid epidemic has taken a devastating toll on Rhode Islanders, and Senator Sheldon Whitehouse has made it a priority to stop overdose deaths in his state. He authorized the Comprehensive Addiction Recovery Act, or CARA, with Senator Rob Portman, as well as CARA 2.0. In addition, during the COVID crisis, he's pushed to increase telehealth access to those battling addiction. Also partnering with Senator Portman on that. Senator Whitehouse, great to see you again, and different subject today than we normally talk about. But let me just ask you this question. In this time that so many people are feeling the stress of COVID, what are you seeing happen? I mean, the opioid epidemic preceded this. I sort of felt like we were making some progress. But what has COVID-19 done to your citizens?
Well, Rhode Island was actually beginning to get our arms around the increase in opioid abuse and overdose deaths, and they were starting to trend in the right direction. And then along came COVID and all of the anxiety and disruption and isolation that it caused for many people. It disrupted some of the organizations, some of the outreach that helped support people who are in recovery. And the result of all of that has been a surge in overdose deaths. And it's been a really tragic sidebar to the tragedy of COVID. And we're going to have to work hard to get it back. I'm pushing hard to try to get, a little bit north of $4 billion for this into the COVID recovery bill that we're going to be vote-a-rama-ing tonight.
Senator, I guess my question, and perhaps I'm going to put this in a way I shouldn't, but there's been so much focus on COVID, appropriately. We're going to have over 500,000 deaths in this country pretty soon. With opioid deaths, we've had about the same number over the last 10 years. And do people think that this is not as high a priority because of the raging burn of COVID, or do they see that we've got to do work on both fronts? I mean, I just wonder if one has been squelched out because of the severity and speed and scale of COVID.
I think to a certain extent that is true. I also think that with respect to overdose deaths and people who are in long-term recovery, we are still emerging from a social point of view about that there is wrong on the part of the person in recovery, and that it's not really a true medical condition. We're emerging from that, and we're making good progress on that. But I think that has also helped hold back the response to the opioid epidemic. Right. But obviously, we've got more than 2,000 dead in Rhode Island from COVID. So, that's really serious, and it required a whole different level of response to try to protect the general population. So it's just been very unfortunate that the effects of COVID itself and the effects of the response to COVID have both been to isolate treatment, isolate care, isolate individuals, and that has driven up deaths. We're probably going to be over 300 deaths for 2020 in Rhode Island from opioid overdoses.
So how are we doing on access? You know, I've looked both at Senator Portman's tweets and your tweets. You had a very powerful one. You said, you know, folks, you're retweeting the Rhode Island Department of Health and saying that folks can request free Narcan or naloxone, if I'm pronouncing naloxone, at you know, their Rhode Island address at no cost. Whereas Senator Portman is complaining that the Biden administration may be inadvertently putting a new speed bump in access, where, you know, requiring prescriptions, there had been a waiver put in place so that people could get this more easily. I mean, it's one of those things that if you need it, you need to get it. But there was a thing there. So I'm interested in, I'm going to be talking to him shortly, but do you think there are access problems around the country? It looks like you've solved it in Rhode Island. But when you look nationally, are we having a problem with getting people what they need when they need it?
Yeah, I think we are. You're now starting to see naloxone as standard equipment for police officers, for firefighters. You are starting to see naloxone as actually available in a variety of commercial settings, in the same way that you have other emergency equipment like, you know, a firefighting apparatus, a fire extinguisher. So I think it's getting better, but there's continued room for improvement, and there's really tough pressure on the best performers in this space, which are our police, fire, and EMT folks. Intense pressure on them financially because of COVID. For a lot of towns and cities and counties, revenues are down, and people managing those budgets are having to make really, really hard decisions. And so getting the funding through to the front lines is going to be very important. And that's why we're pushing for that money in the COVID relief bill.
You know, a year ago, if I had, and I did do programs and events with them, probably with you, where we were looking about prospects for telehealth. Would it go anywhere? What were the risks? What were the problems? We're a year ahead now, and telehealth has become this whole new ecosystem of, you know, access and connection. And, you know, by all means, I don't know how they're going to, you know, figure out the Medicare reimbursement down the road, but it just seems like it's become this new point of access. I'm interested in what you think about telehealth in that environment, and whether it's here to stay, whether it helps, or whether there are problems.
In the dark days of COVID, the one real silver lining has been the explosion of telehealth. A lot of the anxiety and caution about expanding telehealth, particularly on the part of insurance payers, just got blown right through by the need for telehealth through the COVID crisis. And what we've seen, I haven't seen any, you know, peer-reviewed scientific reporting on this, but what I'm hearing from our recovery groups in Rhode Island about this is that not only is telehealth improving the extent of the contact between the person in recovery and their support network, but believe it or not, it's actually improving the content of that communication. And if you think about it, that makes sense. You no longer have to drive across town. You no longer have to wait in a waiting room. You're in the comfort of your own home. You haven't had to fill out the stupid clipboard. It's just a more comfortable environment. And the people who are in the professional side of those conversations are reporting to our groups like, you know, Phoenix House and Anchor Recovery and some of the Kodak, some of the Providence Center. We've got some real star groups in Rhode Island. They are reporting that they're getting far better content with the people whom they're serving. And that is telling a really good story about telehealth. On telehealth, there may be some adjustments ahead of us, but there's no going back.
Yeah, it's fascinating arena. I mean, I love watching it because I remember there were so many suspicions about it. And it's, look at how we've changed, how we've finally gone digital in real ways. You know, just finally, Senator, I want to ask you about blind spots. You know, we have a new administration. The Biden administration has come in, and I know there are a lot of people not confirmed yet. There are a lot of people not in positions. I know there's a lot of detail not there, but you can see kind of where they're at. I'd love to know from you whether on the health front, particularly on the opioid access front, whether you see any blind spots that you worry about on the Biden team. And then beyond that, I mean, because, every administration has blind spots. What are you worried about, on broad public policy issues that you think the Biden team needs to be careful of making a mistake on?
I think it's too early to spotlight blind spots. The team isn't even fully in place yet. I think there are people high up in SAMHSA who really understand this problem. There's a Rhode Islander named Tom Kader, who was a state senator and blew out of the state Senate because of his own substance abuse problems, ended up in court with his, hands in handcuffs. And he's come back. He's now a senior person at SAMHSA. He actually went back to the Rhode Island Senate for a while as the chief of staff. I mean, he's proof positive of how recovery works. And having lived the experience, he really is a very powerful person. And the recovery community and organizations like SAMHSA are full of people who've had that experience now. And I think that gives us a real solid core of institutional support and energy to get things done right, even through a period of transition as we're going through right now between one administration and another. So knock on wood, so far so good.
I'm going to sneak one last quick question in here. You and I have known each other for a long time, and I know that every policy issue you care about, you deeply personalize. Why is this issue such an important one to you?
I really hate it when people are overlooked. There's a real underdog story here. And for a very, very long time, people in recovery were treated as second-class citizens. Their stories weren't really properly heard. Even the medical community turned away from them. There were wonderful doctors. David Lewis and Brown did an amazing job of moving it into the mainstream of the medical profession. There are just a lot of heroes in this space. And I would say that pretty much everybody who has to travel that very hard but very noble path of recovery is a hero. It's hard work. It is brave stuff. You have to confront your demons. You have to work through this stuff. And we all have friends and loved ones who are on that path. And it just gives me real joy to be able to support them and to institutionalize support for the path that they're on.
Well, Senator Sheldon Whitehouse of Rhode Island, he's got so much legislation cooking right now that deals with the opioid epidemic. Thank you so much for sharing your thoughts and really helping to start off this program with us today. Thank you so much.
Thank you, Steve.
And now it's time for a message from Indivior, the sponsor of our event today. Here's Mark Crossley, the CEO of Indivior. Mark?
Good afternoon. My name is Mark Crossley. I'm the Chief Executive Officer of Indivior. I'm grateful to take part in such an important conversation about the impact of COVID-19 on the opioid epidemic. Most of us have never lived through such a challenging time. It can be difficult to quantify the increased stress of social isolation and economic dislocation caused by the pandemic. For what is almost a full year, so many families have borne the burden of this highly contagious virus, which beyond the virus itself also results in heightened stress due to the necessary physical distancing restrictions focused on limiting the spread of the pandemic. Researchers suggest the effects are even more harmful to those grappling with substance use disorders. The COVID-19 pandemic has made a vulnerable patient population even more vulnerable. Data show that since March of 2020, the drug positivity rates have increased, highlighting the worsening state of the opioid epidemic in the U.S. While we don't yet have final data, we can clearly see the acceleration of drug positivity rates at the onset of COVID-19 in March 2020. Additional disruptions driven by the pandemic, unemployment, depression, and poverty are also common triggers of opioid use and relapse, yet another way in which the impact of the pandemic has further fueled the opioid epidemic. According to the Centers for Disease Control and Prevention, drug overdose deaths reached a record high in 2020. More than 83,000 overdose deaths were recorded, a 21% increase over the previous year. Even before the onset of the pandemic, opioid misuse had been a major public health concern. In 2019, over 10 million people aged 12 and older misused opioids in the United States, the majority of whom misused prescription pain relievers. Despite the prevalence of substance use disorder, including opioid misuse, and the existence of effective treatments, including medically assisted treatment, most people who need treatment do not seek or receive it. According to the 2019 National Survey on Drug Use and Health, of the estimated 20.4 million Americans aged 12 or older needing treatment for a substance use disorder, only 2.1 million people, or 10%, received any kind of treatment. This disparity is known as a treatment gap. In some cases, treatment capacity is simply not available, and in others, people do not fully acknowledge their need for treatment. This means that about 9 out of 10 people suffering from substance use disorder, our family, friends, and neighbors, are not receiving treatment. These data were yet another wake-up call to those of us who live this fight, that we still have a lot of work to do to tackle the stigma that surrounds this disease and inhibits people from seeking or receiving treatment. At Indivior, we've spent the last 20 years developing effective medications to treat opioid use disorder. We have focused our efforts on raising awareness about addiction as a chronic brain disease. And while attitudes are changing and awareness and understanding are growing, we still have a tremendous amount of work to do to eliminate the ignorance, the apathy, and the prejudice that create a negative stigma that is a harsh reality for so many people struggling with this disease. We must deepen the understanding of opioid use disorder as a chronic brain disease. We must continue to build awareness that this disease can and must be treated, much like other chronic diseases, such as diabetes or heart disease. How do we start to address this public health priority and close this treatment gap? Similar to previous health crises the U.S. has faced in the past, our policy response to the opioid epidemic should seek to normalize treatment and categorize addiction like any other chronic medical condition. This normalization of the disease is a crucial first step from which we should then transform access to treatment, resource it, and be strategic about where it's needed most. Dr. Nora Volkow, director of the National Institute on Drug Abuse, says the research shows combating stigma is a vital step. Access requires policies that ensure evidence-based treatment is covered and available. There should be no prior authorization requirements or other barriers to treatment. We need a workforce sufficient and educated to meet their need for treatment. We need to leverage technology via telehealth, which brings treatment and counseling to people where they are in their journey. The American Medical Association has recommended extending policies adopted by both SAMHSA and the DEA to provide greater flexibility to patients and prescribers for the duration of the pandemic and the opioid epidemic. Fortunately, Washington and state policymakers have given us reasons for hope. Bipartisan support is building behind both the CARA 2.0 and Support Act 2.0 in Congress. The Bipartisan Medicaid Reentry Act makes opioid treatment available in corrections through release. The new administration has proposed an additional $4 billion in funding for substance use disorder and mental health treatment. I want to take a moment to thank Senator Portman, Senator Whitehouse, and Congressman McKinley for their continued commitment and dedication to helping patients. Our elected officials are among the most critical partners in solving this public health crisis. By coming together to remove barriers to treatment, fighting the stigma, and educating the public on the science of addiction, we can address this overdose crisis and help those struggling with opioid use disorder toward a path to recovery. We know too much about this chronic disease for so many people to continue to struggle. It's finally time to rethink opioid addiction. Thank you very much.
Mark, thank you for that. It's now time for our panel of experts. Karen Freeman Wilson is the president and CEO of the Chicago Urban League, where she's been active in raising awareness around opioid addiction in the Black community. I should also say she was the very cool former mayor of Gary, Indiana, and I remember talking to her way back then, so it's good to see you. I'm going to make sure I pronounce this, Invield Olsen. Please tell me, Dr. Olsen, if I'm getting that right. She is the medical director of the Institutes for Behavior Resources and Outpatient Addiction Treatment Center here nearby in Baltimore. She's also vice president of the American Society of Addiction Medicine and the co-author of a book titled The Opioid Epidemic, What Everyone Needs to Know. And finally, she recently was a part of the Biden Transition's HHS review team, so she knows what they're going to do. She's going to let us, behind the curtains, I hope. And Dr. H. Wesley Clark is currently a Dean's Executive Professor of Public Health at Santa Clara University, formerly the director of the Center for Substance Abuse Treatment at the Department of Health and Human Services, where he served for 16 years. Thank you all for joining me today. This is a sobering conversation, and I try to have energy in these conversations, but I know it's a tough haul and a very, very tough on so many Americans right now during the time of this COVID pandemic. Let me just start with you, Karen, the should say, mayor. I used to mayor on
please
this.
say Karen. It's snowing outside. I don't want any responsibility today.
That's great. Well, Karen, let me ask you. I mean, I look at things oftentimes of, what has priority on the dashboard when you're a policymaker and you're looking at the hard choices you have. We don't have, infinite resources or even infinite attention. And I think part of the challenge today is how do we make sure that the right communities are part of that policy dashboard, part of the policy priority picture. And I'm interested in your perspective. I mean, the Chicago Urban League published something in 2017 I found fascinating called Whitewashed that dealt with a lot of these issues. And I'm interested in what you think is missing that we absolutely have to hear.
Well, first, I want to thank you for raising this and for the opportunity to join this panel. And one of the things that we always have to look at is the ability to protect our most vulnerable citizens. Whether we're talking about youth, whether we're talking about our seniors, we know that those who are addicted to alcohol and other drugs suffer, and they have to have access to the treatment that they need. And that is why we did Whitewashed back in 2017, because we understood that there was a focus on white suburban youth, but that the opioid epidemic was certainly impacting and had been impacting the Black community for some time. And it's our position that it's not either or, it's both and. And so we want treatment on demand. We want access to treatment. I want to certainly commend the Biden administration for this focal point, but we also know that we need that treatment in the justice system, and that's where drug treatment courts and treatment through the court system comes in.
Well, Doctor, thank you for that. Dr. Clark, I just want to read a section of something that you wrote that builds on what Karen just said. You said, Black patients come to substance use disorder treatment with a spectrum of experiences that traditional paradigms of medical intervention often don't address. I've found that unitary concepts such as abstinence or harm reduction or dependence and even drug use are inadequate constructs in the lives of Black patients seeking support in this area. I feel very powerful because I think a lot of folks don't have easy on-ramps where they understand the systemic issues that are involved. And I would love to get your view of how we reach these vulnerable communities, but how often we make mistakes in how we try and reach them. I think you're on mute, Dr. Clark. But you looked like you were jumping out of your chair. Go ahead.
Well, like Mayor Wilson, Freeman Wilson, I want to thank you for addressing some of these issues, and these are critical issues. One of the things is that people fail to realize is that as a result of the criminal justice issue, Black patients are often stigmatized, suffer discrimination because of some of the criminal justice related issues. And people tend to look at it only in terms of medication, only in terms of the drug use. But in fact, when you're locked out of society, when you are precluded from participating because you are a felon by circumstance, drug use in the inner cities or among Black people results in criminal sanctions, whereas drug use among white people results often in a slap on the wrist or being directed to substance abuse treatment, which is accessible. So we're dealing with the issue of stigma, discrimination, and access to treatment. And we're dealing with policies that limit people of color from participating in the substance use phenomena. The fact that people are worried about overdose is great, and I really want to commend the Biden administration for its comprehensive view of how we're going to deal with some of these issues. But the key issue is making sure that people see that Black, Hispanic, American Indian, Alaska Natives, and even to a lesser extent, the Asian American community, because as a treatment provider, Asians also suffer from substance use disorders, and they tend to get forgotten because, quote, they're the model citizens. Some of my Asian colleagues point out that that isn't the case. They may not have the prevalence rate, but they have some of the similar issues. But discrimination, stigma, and lack of access are key issues. Housing, employment, access to food, being able to be parents. And one of the things we know about Black overdose rates is that the Black people tend to be older, and that's in part because they get incarcerated. And by the time you get out of the criminal justice system, you have a lot of other problems, and you don't fare as well.
So we've had just, two snapshots, Dr. Olson, that say that, as you kind of look at the communities that have been sort of left marginalized, not in the, main thing, I worry a lot because I've visited cities. I've kind of spent a lot of time trying to investigate both in rural communities, rural West Virginia, but also, in a lot of the areas that Karen deals with in Urban League, right in, the center of our cities, how so many people can be left off the map. I want to bring in the mental health picture on this, Dr. Olson, and let's put Dr. Olson on the screen here. So I can see her. There we go. But ask you to basically chat with us, for a moment about what we're missing on the mental health front. And I'll just put a little preamble on it. Francis Suarez, the mayor of Miami, is someone I've become friends, but began talking to him about coronavirus early on last March in my daily coronavirus report back then. And he said, Steve, the thing nobody's talking about while this is going on is the severe impact on mental health and all of the downstream behaviors in this time of stress. Everyone's afraid to talk about it. Everyone's afraid to help. I'd like to get your snapshot because that was last March when I had that discussion with Mayor Suarez. So to give us an understanding and an on-ramp into this that makes it more real for us.
Yes, no, and first, thank you also for having me as part of this very distinguished panel on this very important topic. I think we all have experienced that, over the last year with COVID, that everyone is feeling increased stress, isolation. We have data from the Centers for Disease Control in August that shows that about 40% of Americans report experiencing at least one symptom of either depression, anxiety, or something called stress-related disorder. So certainly large percentages of the population are really being impacted very significantly with respect to mental health. That is especially true in our young people, 18 to 24-year-olds. The CDC actually noted that close to 75% of that age group is really struggling with those types of symptoms. And when you look at actually the intersection between mental health and substance use disorders, we know even before COVID that the co-occurrence or kind of the simultaneous occurrence of depression, anxiety, and substance use disorders is, prevalent. We see it in about 40 to 50%, sometimes even higher in certain populations. So when you think about kind of the economic stress, the isolation, the increases in these symptoms of depression and anxiety, and you then bring in the substance use disorders, it really is kind of a perfect storm, for many, many, many vulnerable individuals, as has already been mentioned, to then really be in very, very precarious situations. I think the other point I would make is that for people not only who already have a substance use disorder, particularly an opiate use disorder, that the situation becomes even that more critical because the substances that are now really prominent on the street, fentanyl, is so lethal. And so when you have individuals then who are now, trying to kind of deal with the symptoms that they're experiencing, the problems with mental health, and the lethality of what is available, and then on top of that, really then being cut off perhaps from their healthcare providers, from their therapists, from their physicians, and really having to try and kind of navigate this telehealth world, it really is a serious issue.
Let me thank you for that. Let me just ask you all a question. I sometimes don't know how my own questions are going to come out. This is not written down. Watching the COVID crisis, watching people scramble for the vaccines. I'm on the alert every day from the city of DC telling me if I'm going to, be in the right zip code or on the list or what, and I'm sure many, many other people, who are actually way further up the list than I am are looking at this. When you get to something like opioid addiction or a substance use disorder, and you have got to interact to try to get support. Dr. Lena Wen, when she was the health commissioner for the city of Baltimore, issued essentially a citywide prescription to get everyone essentially over-the-counter access. I thought it was an incredibly bold move. Now, that was years ago. I don't know the state of play today. Karen, I don't know if you're in the world of that urban leagues all around America are dealing with, whether those access points are easy, hard, complicated, whether the notion that people have to sign up online or see a health practitioner. I'd like to hear from each of you, if you don't mind. What do you think are the roadblocks that we need to get out of the way, or what are the pieces of infrastructure we really need to kind of get help to people where they are? Karen?
I think that you find that everything is harder to access under COVID, and that's unfortunate. And so you will find that treatment, particularly medically assisted treatment, is more difficult to access. But the way that it was done in Baltimore gives all cities an opportunity to, quite frankly, get it right. The issue, though, is the prioritization for funding, because we know it's not free. And so how do you get cities to say, this is a priority? This is as important as the vaccine. This is as important as insulin. This is as important as other things. And I think the way you do is treat it as a public health crisis, the public health crisis that it is.
Do you think the Biden administration, Urban League is such a powerful group, and your National Association of Urban Leagues, are they hearing that message?
We are hearing that substance abuse is something, and substance use will be a priority and is a priority in this administration. But ultimately, you determine what priorities are by what you see funded. And that's so it can be a priority of the administration, but if Congress does not provide the appropriation, then you will see that it can't be that much of a priority. We're hoping that it will be treated that way by Congress.
Let me ask Invield and Wesley Clark the same question, but slightly different. Both of you in your writing, which I've taken a look at, really deal with the systemic dimensions, all the surround sound of this problem, as opposed to, here's one track, and we just approached that track. So we need a systemic answer to deal with this systemic problem. And so, Wesley, what would you prioritize in that? I've been reading carefully what you've written in it, so it's a big lift when you're kind of, trying to deal with all the different dimensions. And I'm just going to ask you whether you're hopeful or pessimistic that approach can be taken.
Well, first of all, I'm glad you're raising this issue. I think I'm off. Dramatic changes are urgently needed, and marginalized populations have to have their issues addressed. And I think the Biden administration is committed to that. The announcements about the interim people at SAMHSA, Tom Cordero, who I know, at ONDCP, Regina LaBelle, I know, they're committed to dealing with this. I've been dealing with this issue for over 40 years. 29 years ago, I wrote a disputed paper on supporting a needle exchange. And there's a lot of pushback because of the issue of stigma and discrimination. So harm reduction as a component, access to treatment, and making sure we've got people who are sensitive to the needs of the community. It's one thing to inherit that there are these issues of diversity, equity, and inclusion. It's another thing in having people in place who can recognize that these things are important. And you need concrete solutions. We don't need platitudes. We need people who can envision these concrete solutions and help put them in place. The administration's in a position, they've got people already appointed at high levels and will continue to, I'm sure, appoint people who can relate to the need for concrete solutions. So you've got all these departments, Health and Human Services, Department of Justice, HUD, Commerce, Education, Labor, all of these entities need to be brought to bear. And as Karen said, we need to recognize that a public health emergency exists that consists not only of the pandemic, COVID-19 pandemic, but also of substance use. And keep in mind that the overdose deaths continue to change, just like you have variants in COVID-19. We are now not only seeing fentanyl, we're seeing stimulants like methamphetamines reemerge, cocaine's reemerge. So when you look at those 80,000 overdose deaths, there's a substantial part of them made up of stimulants. We need strategies like contingency management or incentive-based contingency management in place.
Well, thank you for that, and I love your commitment to this topic, Dr. Olson. Your thoughts?
No, absolutely. I mean, I think that this is, if you look at kind of substance use disorders as well, they're not unidimensional. They are actually multidimensional. And so, we really need to take a multidimensional approach to be able to effectively address them. And so that means having, housing supports. It means having employment. It means having a robust workforce that also understands and can address these issues in a multidimensional way. I think both Dr. Clark and Mayor Freeman Wilson, said it very clearly. This is a public health emergency that we need to really address as one. And so that means that we need the robust funding. We really need the robust kind of elevation of this issue, and so that we can actually then have the resources available to really be able to do that. Over the last several years, certainly Congress has taken steps towards doing that. SAMHSA's budget has nearly doubled over the last few years. And so I think there certainly is a recognition that this is an important issue that is affecting large areas of the country, large populations, and particularly the vulnerable populations, people of color, who then also have may need additional resources and additional attention. I think one of my colleagues, Dr. Ruchi Fitzgerald in Chicago, had said that addiction doesn't discriminate. But we then have the choice of how we respond. And so responding in an appropriately sized way with appropriate attention to all the needs of the people who are affected by this and the communities that are affected by this is really what is going to get us to the place where we can really address it effectively and comprehensively.
Terrific. I mean, I really want this conversation going on. We got a couple of questions from the audience I'm going to try and squeeze in. We'll get real fast answers to them if we can. We have Sarah on board. Sarah?
Good afternoon. My name is Sarah Corcoran from Washington, D.C. On behalf of the Behavioral Health Information Technology Coalition, my question is, can you speak to the role that telehealth and CARA 2.0 will play in the mental health and addiction space, given COVID-19's exacerbating effect on mental health in the United States? Thank you.
What an appropriate question. Dr. Clark, you want to jump at that?
Oh yeah, when I was at SAMHSA, I was a major proponent of health information technology, including telehealth. And telehealth, not just for rural communities, although the issue of broadband is very important still for rural communities. We need to be able to exploit telehealth. We need to make sure that it is sustained not only during this pandemic, but after the pandemic, because it increases access to treatment. Everyone just about has a smartphone that has all sorts of capabilities. We need to be able to allow practitioners to reach their patients where they are. We need to also be able to promote recovery-oriented strategies, and telehealth will allow that, so that a person isn't just seeing their practitioner or their clinician once or twice a week, that in fact, if they need support, they got it 24/7.
Sure.
So organizations that deal with recovery recognize the utility of telehealth and health information technology so that it can enhance the recovery of people.
Terrific. Thank you. Karen, do you have a quick reaction to that?
I do. I believe that it is clearly a matter of health equity in terms of allowing people to utilize telehealth. And in fact, the Chicago Urban League is getting involved in promoting that, because we understand the importance of telehealth in the health equity conversation.
Well, thank you. I think I'm going to jump to the next question because it's perfectly made for all of you, but particularly for Dr. Olson. We've got Jake on board. Jake?
Hi, my name is Jake Jackson. I'm with the National Board for Certified Counselors. We're the national credentialing body for mental health counselors in the United States. I represent about 68,000 nationally certified counselors all across the country, and I'm based up here in the Washington, D.C. area. My question is, how can we address the impact of COVID-19 and the opioid crisis on Medicare beneficiaries in particular? Thank you.
Dr. Olson, that's yours.
So that's a great question. You know, I think that the Medicare beneficiaries that are older, that, you know, as Dr. Clark mentioned, you know, many older individuals may have had long histories of substance use disorders. And because they also are now really being impacted by COVID, we're telling people to stay home. We're telling people, you know, to stay inside their homes. That increases the isolation and loneliness. And so really figuring out how can we actually then keep people connected, keep them safe, and make sure that we're getting Medicare beneficiaries also access to vaccine as is being prioritized, you know, kind of in many states and many areas across the country. You know, I think that some of the solutions that we've talked about in terms of telehealth, for example, and having broad access to telehealth that includes phone and includes phone only. You know, about 50% of my patients only have a phone that that works as a phone, as opposed to, you know, kind of with a camera. And we have, you know, an average age of close to over 50. And so I think as the population is aging and we're making sure that they can stay connected, stay in treatment, as well as, you know, really the harm reduction components are incredibly important. And so making sure that we can actually have a continuum that that includes harm reduction, treatment, and recovery services, and particularly within, you know, the Medicare program, Medicare Advantage plans that then are adhering to parity and really being able to actually provide all those services to the Medicare population.
My producer is going to get so angry at me, but I'm going to ask like each of you one last question. I think it's really important with folks we have watching, and that is, you know, we talk a lot about stigma. We talk a lot about, you know, people hiding this because they fear the social consequences of this. I've gotten to know some folks in McDowell County, West Virginia, thanks to Senator Manchin, in part because of this issue and my interest there, and trying to hear them and connect with them, be of help where I can. But I think a lot of people hear the word stigma. They don't want to stigmatize folks, but they have no idea how to actually walk the walk of that. I'm just interested in any life insights you have where people can really get over their own stigmatizing of others with this. I wish I'd brought someone on today who was suffering in this issue to hear their view of how they feel in this, but that didn't come together for this. But I want to hear, as you have all dealt with this, just a quick snapshot of what our listeners who want to do better than they're doing in terms of reaching out, understanding about not stigmatizing this. It's one thing to say it, it's another thing to do it. Any quick thoughts, Karen?
It's important for people to understand that this is just like cancer. It's like diabetes. It's a medical illness. It's a relapsing, debilitating challenge. And when people understand in the context of medical conditions that they suffer from, they tend to change their perspective.
Dr. Clark?
There are organizations like Faces and Voices of Recovery, organizations like Stop Stigma, and other organizations. So I want to encourage people to talk to people in recovery as well as talk to people in treatment or talk to people in need of treatment, all three groups. And once you talk to people in recovery, you can understand the benefits of recovery, not just for the individual interactions, but for the society at large. So I just want to make that pitch because Karen's point is well taken.
Thank you. And Dr. Olson, last word.
I would say that, it can start with language. We can really watch, kind of the terms that we use. So avoiding stigmatizing terms like, abuser, addict, junkie, really saying, using terms like a person with a substance use disorder or a person with an addiction, saying that, it's a person who is in recovery, not necessarily clean or dirty. And so there's a whole host of non-stigmatizing terms that ONDCP, the Office of the National Drug Control Policy, put out under Michael Botticelli's direction during the Obama administration. There are fact sheets and tool guides, even for the press and media, that can help, really change language. And language matters because it certainly exemplifies, some of the attitudes that we may have towards this disease.
Listen, I really thank all of you. I added a few minutes to this session because it was really worth it. I want to thank all of you. Dr. Invield Olson, Medical Director of the Institutes for Behavior Resources, Dr. Wesley Clark, Dean's Executive Professor of Public Health at Santa Clara University, and Mayor Karen Freeman Wilson, who's not responsible for the snow, President and CEO of Chicago Urban League, and former mayor of Gary, Indiana, a very historic mayor in Indiana, I should say. Thank you all so much for joining us today.
Thank you.
Thank you.
Thank you so much.
All right. Take care, everyone.
Bye-bye.
My final guest of the hour is Senator Rob Portman of Ohio. I spoke with him just a short while ago. Senator Rob Portman has worked to combat addiction in his state of Ohio and is responsible for a number of bipartisan pieces of legislation on this front, including his work with Senator Whitehouse on CARA and CARA 2.0. He's also crafted the Synthetics Trafficking and Overdose Prevention Act, or the STOP Act, to stop synthetic drugs like fentanyl from getting in the hands of Americans. Senator Portman, great to see you, and thanks for joining us today on this very, very important and, frankly, sobering topic. I want to just start out on a human front. You've done so much in this area. I've got things you've done all the way back since 1996 to create the Coalition for a Drug-Free Greater Cincinnati and so many. Why is this such a personal issue for you?
Well, I have friends and family who have been affected by addiction, but I got started in a sort of strange way. I was elected to Congress in '94, and shortly thereafter, a constituent came to see me who had her son die of an overdose, and I was prepared. I was dutifully preparing, as I try to do with all my constituent meetings, maybe over-prepared. And I said, look, I have an answer. $15 billion a year is spent on interdiction of drugs, on prosecution of drug criminals, on dealing with the supply side, in effect. And she kind of looked at me and said, how does that help me? I went to my church to ask them to help, and they were in denial. They were saying, we don't have a drug problem here. I went to the school where my son goes, and they didn't want to talk about it. And I called a neighborhood meeting, and only my good friends showed up. And at the same time, I was looking into, how drug addiction in particular affects everything else, welfare, crime, just the cost of the federal government. And her point was, it really has to happen at the community level. So that's why I got involved. And it was setting up my own community coalition back home, which is still going. I chaired it for 9 years. I was on the board when I ran for the Senate. I'm going to stay involved with them. They've done a nice job, but also 2,000 community coalitions have been spawned by the legislation we wrote that year called the Anti-Drug Coalitions Act, which continues to provide grant funding on a matching basis to groups that pull together all sectors of the community to address the prevention side. And then more recently, of course, with the opioid epidemic, I focused more on the treatment and recovery and side. And there, Sheldon, Whitehouse, and I wrote this bill called the Comprehensive Addiction and Recovery Act, which has been very, very helpful. And the heartbreaking thing, Steve, is that we were finally making progress. You know, as of 3 years ago, we had the lowest overdose rate we've had really in decades. Ohio had a 22% reduction in overdose in 2018. As an example, it was really heartening. It was like everything was starting to come together, the federal legislation, working with the states, working with the local communities. And then the epidemic hit, the pandemic, and the epidemic underneath it has been the drug issue. And unfortunately, in 2020, so during this year of the pandemic, we will end up having the worst overdose rate in the history of our country. So we go from a relatively high level, we made progress, now we're going back up again. And it is heartbreaking to see the results back home. I've met with literally thousands of addicts and recovering addicts over the last several years, and unfortunately, that number is now growing. So we have to look anew at this problem, come up with fresh ideas. We have a new bill, CARA 2.0, to help address some of these issues, like telehealth that needs to be expanded, and dealing with the isolation and the despair people are feeling because we're slipping again. And so that's where I'm focused now. We have new legislation we're trying to get passed even in the very short term here as an example to say to these community coalitions, you can get your federal match without having to find the nonprofit or private sector match because they're having a hard time right now with so many other needs out there. People wanting to focus on things like food pantries, which is good and understandable, but we also need to keep the prevention level high enough to try to continue to make a difference.
So I just want to clarify on what you're trying to do on the federal match. That actually would put the federal dollars first, as opposed to waiting for the community development to come in. Just to make sure. Are you finding? I want to get to the Biden administration in a moment, but so far, are you finding the Biden administration open to that sort of approach?
I think so. Honestly, they don't have a drug czar yet. They don't have an HHS secretary confirmed, and they don't have the people in place. But we're already beginning discussions, and there's somebody over at the drug czar's office, the Office of National Drug Control Policy, who's a career person we're working with as an example. So my hope is that they will. I mentioned it to the president this week, in fact, and he seemed to agree. We talked about the very issue we just talked about today, which is the epidemic underneath the pandemic and how we redouble our efforts. This has always been, I would say, nonpartisan, not even bipartisan, all these bills and all this work. And I hope that in this administration that we will have some level of bipartisanship, at least post-COVID. In the COVID bill that the president has proposed and in the one we just passed and in the one that we've just proposed, we Republicans, they all have some funds set aside for dealing with this issue, the drug addiction issue broadly. And as you know, Steve, it's not just opioids. In fact, increasingly, it's crystal meth coming from Mexico, perhaps mixed with fentanyl, which is the synthetic form of opioids that's so powerful and so deadly. So it's cocaine. It's a mix of drugs. Back home, what I'm hearing, and I spoke to a bunch of the drug coalitions this week. In fact, we did a virtual meeting with drug coalitions all around the state. It's everything. It's not just heroin or prescription drugs. It's a mix, and we have to have flexible legislation to respond to that.
Thank you, This is very powerful. Senator, a few years ago, I interviewed Lena Wen. Lena Wen's now one of the voices on the COVID crisis on CNN all the time, the Washington Post. But when she was the health commissioner for the city of Baltimore, she wrote a standing order. It was sort of an open prescription that essentially took naloxone and made it available as an over-the-counter drug for anyone that needed it so they could get quick access. So one of the issues is access and need and speeding that up. And I know you've been critical of the Biden administration of rolling back those provisions that require essentially another step in the process of prescribing these important opioid response drugs. Can you tell us a little bit about that and your criticism of the Biden team on that front?
Well, I support Narcan, which is a what most people know about when you say naloxone. It's the Narcan that our police officers
Sure.
and firefighters and others use, and families use to help save family members who overdose. And our legislation provides funding for that. The CARE legislation, as well as another bill that came out of the 21st Century Cures Act. So we've put substantial federal money against having Narcan readily available. And I support having it be over the counter. When I go to drugstores, which I've done a number of times, to the Kroger or Walgreens or CVS to make announcements about, their decision to make it over the counter, I thank them for that. But I also tell them that I think it's necessary to have another step in the process, which is that providing those individuals who purchase this some briefing on and at least a list of treatment providers in the community. Because it's not sufficient just to have somebody who is a family member and someone is dying from an overdose to use Narcan. That's incredibly important. It's absolutely essential. But it's not sufficient. What's sufficient is then to take the next step and, how do you get that person help? And how do you do it in a way that, is effective? And so we spend a lot of money and time on the CARE bill as an example with these groups that can come into a home, which would include a social worker, let's say a treatment provider, perhaps a firefighter, perhaps law enforcement together. They're called quick response teams is the general term for them. Ohio has been one of the leading states in this. And being sure we're connecting people to services. So when somebody has an overdose, it's not just giving them the Narcan needed to save their lives and then walking away. It's actually doing the follow-up and getting those people into treatment. And the success rate is unbelievable. You would think if somebody walks into your living room, including a law enforcement officer, there might be a negative response. Not so.
Right.
I mean, I've been out with these folks in the community, visiting people, visiting addicts. There's a good relationship that builds up. There's a trust relationship, and a lot of people have gotten into treatment as a result. So that's my general concern about not having that second step.
Senator, just finally, I've been through Ohio and Pennsylvania and Western Maryland and the Eastern, Shore, and you see communities all over with signs up, clearly struggling with folks that have opioid addiction. But what I think is inspiring is a real effort, at least what I'm seeing, to remove the stigma, to invite people in for support, to talk, so that this isn't the traditional kind of zero-sum game in a lot of the drug war stuff. So I guess I would ask you, are you hopeful that kind of spirit of helping people that are, as you said, desperate in these times that's something you can't legislate, but we need a bit of trust in communities. I'm interested in your insights in that, because we've heard so much today about this challenge in the nation, but I know that you feel this and you're doing the legislative front, but there's something about how communities are pulling together that I think is an important part of the story.
Yeah, you're absolutely right. And there's been our sea change. I mean, if you talk to law enforcement today, you'll get a very different read than you would have gotten certainly 10 years ago and even 5 years ago. And I think it is an acknowledgement that we can't arrest our way out of this problem. It's about getting people, as I said earlier, into treatment, dealing with it as a disease, which is what it is. Give you one small example of this. In our legislation, CARE 2.0, we have legislation that ensures that workplaces don't stigmatize people who are in treatment by saying that drugs like methadone or Suboxone, which are used as part of medication-assisted treatment. In other words, it's a way to take people from an addiction to heroin or fentanyl or some combination of drugs and have them be on methadone or some other drug for a while under a medication-assisted treatment program. And if they're in the workplace and the drug test indicates that they have these drugs in their system, right now, in many cases, that's considered a violation. And therefore, there's a stigma attached to it. It shouldn't be. And so we're trying to make sure that those kind of controlled substances don't count as a drug-free workplace violation. So it's a small step, but an important example of just a change in attitude that can make a big difference in terms of getting people into and keeping them in treatment. But you're right. I think there are communities around this country where there's been just a sea change. I remember being at a fire station in Ohio. This is probably 3 or 4 years ago, and we did an event there talking about our legislation that provided basically a one-stop shop for people who were suffering from addiction to come into a fire station on their own, and there'd be no questions asked, and they would get into treatment without any law enforcement consequences. And a lot of the firefighters, were sort of thinking this is new. Normally what we're doing is we're referring people to the law enforcement folks when we find there's an overdose and people are getting arrested and so on. But they were open to it. And while I'm there, a young man had come, and I was in the firehouse, he was in the offices, and I asked if I could talk to him. And I've stayed in touch with him since. He walked in off the street. He was a part-time construction worker who just could not kick his habit. And he was an opioid addict, and he was ready to face up to it, he said. And sure enough, we got him into a treatment program through these firefighters, working with him, a local treatment program. This is in the Columbus area that's very effective, called Maryhaven. And then I stayed in touch with him, and he ended up out in Eastern Ohio at a longer-term recovery center. And at least last I've talked to him, and look, people have relapses. The last I talked to him, he was successfully back on his feet, working full-time, and contributing to society and reconnected with his family. And it can happen. And that's because that community decided, we're going to open the doors here. And you mentioned the signs. The sign there was, if you've got an issue or a family member has an issue, come on into the firehouse and see us. We'd like to talk to you. And his positive experience then is communicated to someone else in the community who's an addict, and or somebody who's a recovering addict who wants to help the next person along. And that's happening all over the country.
Well, Senator Rob Portman of Ohio, it's a very powerful story. I think these human stories are so vital and important when we discuss issues like this. I have to also tell you, it's a real pleasure to talk to both you and Senator Whitehouse. It's great to see a bipartisan effort on such an important issue. Thanks so much for joining us today.
Thanks for your interest in the issue, Steve. It's great that you guys are talking about it, and we'll get out of this COVID-19 crisis at some point. I hope late spring things will be very different there because of the vaccinations. But this is going to be a lingering problem we have to turn our attention to. So it's great you guys are covering it. Thanks for your interest.
Thank you, sir.
Take care.
That brings us to the end of our program today. A big thank you to Indivior and to all of you attendees for joining us for this set of important discussions. If you missed any of our conversations, we're going to have the entire set on our website shortly, and you can watch it all there. I'm Steve Clemens. Be well.